Hello, Otterbein residents, family, and friends. Kendra with you today. It's been a while since I've provided a video update, and I know you have received quite a few letters from me over the past couple weeks, so I thought it would be a good idea also to come to you via video, just to also provide some of those updates as well. What I'd like to do today is not only give you a COVID update as we are today, but also just an update in regards to indoor visits, which I know many of you have heard about, whether that be through the governor's update, maybe something you read, or of course the letter that I also sent out regarding indoor visits. And then just some general updates on campus. So let's start with our COVID-19 update. We have had a slight uptick, unfortunately, and again, I'm sure you've received those letters from me. I send them out every time we have a new case. So I do want to let you know that as of today, we are up to 22 residents, 7 caregivers, and still at 3 contractors who have tested positive for COVID-19. So yes, if you recall, we were kind of staying steady there at 13 residents for a while, but we have, like I said, had an uptick. What I am happy to share with you, if there is any good news to share, is for the majority of everyone is asymptomatic that is currently positive. Anyone not is just showing mild symptoms. No one has been hospitalized because of COVID-19, so that's a good thing. But what we have done, especially for our healthcare residents, is we have reopened our COVID unit. And that, of course, is just in an abundance of safety and caution to help minimize the spread, keep everyone safe. So those residents currently on our COVID unit, what that means is they are still testing positive and they have the same caregivers. So they have consistent care, so we don't have those caregivers going back and forth for those who test positive and those who do not. The main uptick that we saw did occur on our newcomer neighborhood. Just being very transparent, we are doing our tracking and kind of looking back to see if we can figure out the why to that. So we are actively working on that. What I'm also pleased to share with you today, besides those 5 individuals who tested positive on newcomer, everyone else as of today has tested negative. So that's great news, negative on newcomer. So I'm very pleased to share that news. As I have mentioned many times before, we continue to aggressively test as part of the Otterbein offensive. Again, I continue to say it's working. I think it was the right thing to do. I think it continues to be the right thing to do. And we will continue to do that until further notice. So what that means is we continue to regularly test all of our partners, of course, all of our healthcare residents, all of those living in the Aurora, our assisted living residents. All of those residents are tested routinely who live in independent living in a congregate setting, so in our apartment buildings. And if you do live out in the courts or patio homes or orchards, you may call the clinic and request to be tested, and we will do that for you. So again, we'll continue to do that. And honestly, that's how the majority of our cases were found, because again, they were asymptomatic, so we found them through our routine testing. The other big thing that I want to share with you today is around indoor visits. So yes, we started with window visits months ago, and then we did the outdoor visits, and I know everyone is missing their family and their loved ones and their friends. So a couple weeks ago, Governor DeWine, if you did not hear, authorized indoor visits to take place. We did send a letter about that, so hopefully you received that. But I want to share with you just some details and some clarification around indoor visits. First of all, starting with independent living, again, those in our congregate setting in our apartment buildings. Indoor visits do start next week, the week of October the 12th. What we are asking is that your family members or your loved ones screen in before they come to visit you. So they would do that at the main entrance where they answer a handful of questions, and of course we take their temperature. We do ask that you have your mask on at all times, both family members and residents. You do your best to social distance, but I know we've missed each other greatly. And one little clarification: I've been asked by several family members, do I have to call to make an appointment? And yes, that would be ideal, but I will tell you, with a few hundred residents living in our congregate setting, that can be really difficult to manage. So we are going on the honor system and asking, again, you be screened, you wear a mask, and one item that we are mandating is there is no visiting in any common space. So whether that be lounges, the Great Wave Cafe, I'm trying to think what else. Anywhere where, again, multiple residents could gather at one time. So again, what I ask is that when you come in, if you're a family member or a loved one, that you go straight to the resident's apartment, you have your visit there, and you immediately exit after that. So again, no visiting in common spaces. So that's for independent living in a congregate setting. As for assisted living, the Aurora, those visits, you do have to make an appointment. You do that through Dawn Burnett, and she will set up that appointment for you. There are no more than 2 visitors at a time, and this is a little kind of flipped from independent living, where you will not be visiting in the apartments. You will be visiting on the first floor in our first floor lounge in the Aurora. And again, Dawn is helping manage all that. So when you want to set up an appointment, just reach out to Dawn Burnett. Similar though to independent living, you must be screened, wear a mask, and social distancing will be in place. Now, as for our healthcare neighborhoods, so our newcomer, Asbury, our transitional care unit, Matthews and Daisy Lane, this is a little different. And I'm sad to say that indoor visits in these areas are not able to start next week. And the reason for that is because we do have active cases on campus. So we are following the guidelines from the Centers for Medicare and Medicaid, CMS. And because we do have active cases and we are currently testing, again, to keep everyone safe, we cannot open up indoor visits at this time, nor are outdoor visits happening either. You can do a window visit, but I do need to remind you that indoor visits for healthcare cannot happen at this time. I wish I could give you a date when that will open up, but we're just not able to do so because of the active cases. And I want you to know that we had a positive case in healthcare as recently as yesterday. So when that changes, and I hope it's soon, please know I hope it's sooner rather than later. When that changes, we will get all of that information out to our families so they know when they can conduct those indoor visits. When that does happen, healthcare, very much like assisted living, the visits will not be held in the rooms. They will be in designated areas assigned kind of by the partners here in the leadership team. You will have to make an appointment. You will be screened. You will need to wear your mask, and social distancing will be in place. So again, look for more information to come on that. So that's kind of my COVID update for today. Just a couple other things before I wrap up. I'm coming to you today to discuss testing requirements, specifically testing for our family members and loved ones that are going to be coming to campus for our indoor visits. Please know that when I refer to testing, we are following all of the guidelines and recommendations set forth by the Centers for Disease Control and Prevention, as well as the Centers for Medicare and Medicaid Services, and the Ohio Department of Health. And all of the items and requirements that we've put in place are really just to keep everyone safe and to do our part to help contain the spread of COVID-19. So I want to break testing down for you by levels of care because it does differ slightly. For independent living, let's go there first. For those residents living in an independent living setting, so our apartment buildings, congregate setting, indoor visits are opening up the week of October 12th, and your family member and or loved one does not need to show proof of a COVID-19 test. However, what I would very much like to stress is we highly encourage family members and loved ones to be tested before your visit. Again, that's just doing our part to keep everyone safe. So again, independent living, congregate setting, those in our apartments, we're opening up those indoor visits. You do not have to show proof of a test, of a negative test, but we do highly encourage you to be tested before coming on campus to visit. So that is independent living. Now let's move to assisted living and healthcare. First of all, you are all very aware from my previous communication that unfortunately, indoor visits for healthcare cannot happen just yet because we have active cases in those neighborhoods, and also we are continuing to test. We're outbreak testing, as we call it, since we did identify a few positive cases. As soon as I know the date that we will be able to open up indoor visits for healthcare, I will certainly let you know. However, when that does happen, I want to make sure everyone understands the testing protocol for family members and loved ones, because it does differ from independent living. So for assisted living, which indoor visits will be starting the week of the 12th. We are opening up at that week. So for assisted living and then healthcare when the time comes, you as a family member must show proof of a negative COVID test before your visit, and it must be within 14 days of that visit. So again, I want to be very clear about that. So assisted living residents who have a loved one coming in to visit, and healthcare residents, when the time comes and a family member is coming in to visit, you must show proof of a COVID-19 negative test within 14 days of that visit. The visits in those areas will be scheduled by appointment, so you will know when your visit's coming, so hopefully that gives you time to plan and set up a time to be tested. I also want to make you aware that you also need to bring identification with you when you come to visit. We need to track some information, so something such as a driver's license, you will need to bring with you upon your visit. So I hope all of that is clear. Again, I did send some documentation out. If you have any questions regarding that or anything that I've shared with you today around testing for family members and loved ones before your indoor visit, please don't hesitate to reach out. In regards to outdoor visits, which we have been doing for a while, as long as the weather stays nice, we will still do outdoor visits. They're on hold right now again for healthcare, but we are still doing outdoor visits for assisted living for those residents in the Aurora. You do not need to show proof of a COVID-19 test, a negative test. We do encourage it, just like we are with all levels of care, but you do not have to show proof for an outdoor visit only. Indoor, you must show proof. So again, if you have any questions, please do not hesitate to reach out to myself or anyone on the Otterbein Lebanon team, and we will do our best to answer all of your questions. And again, we're looking forward to seeing many of you and having you come in for your visits. So thank you and have a great day. I do want to give a shout out to Rhonda and Jill in the Independent Living Programming Office. This past Saturday, we were not able to partake in the county or the regional Alzheimer's Walk, which is obviously a cause very near and dear to all of our hearts. And so Rhonda had an idea to bring it on campus, and it was a huge success. We did it keeping everyone safe in their mask and social distancing, but we took a nice walk around campus. It was a beautiful day, and more importantly, we raised a lot of money for the Alzheimer's Association. So a big shout out to them. I also want to let you know, to those who are able to attend, we will be having an Oktoberfest on October 16th, probably one of our last outdoor events. And again, a shout out to Rhonda and Jill and the programming office, because they have continued to do a great job, the best they can with the restrictions that are in place. You've heard me say it hundreds of times, but with mask in place and social distancing, and we do all that to keep you safe, but also want to bring back some sense of normal. So if you're able to get down to the pavilion and the Koi Cafe on October 16th for the Oktoberfest, I highly encourage you to do so. So with that being said, I hope you're all doing well. I hope you're staying safe. As I always like to say, please remember to wear your mask. I want to show my newest one here. How about that? I can support Otterbein Lebanon everywhere I go now. And again, wash your hands and social distance, and please, again, be safe, and I hope to see you all soon. Have a great day.